Welcome back to Fox 11. Time to get updated on the pandemic with our medical expert, Dr. Ernst von Schwarz, medical researcher, cardiologist. Good morning, Dr. von Schwarz. Thanks for joining us. All right, we got a lot to get into today. Let's start with just how things have improved, or have they improved since the last time we spoke 2 weeks ago?
They did, actually, Joe. Thanks for asking. I mean, I personally think that COVID is not over, of course, but I think the worst is over. So compared to 4 weeks ago, for example, we do see less admissions. We have less people dying. We still admit patients with COVID and even those with severe disease, but overall the numbers go significantly down, and that's across the state.
What about this California variant that we've seen? There's been a lot of reports over the last 3 or 4 days about more cases, more serious cases because of this variant. Is this something you're seeing, and what do we know about it?
Well, what we know about it is based on a study from the University of California, San Francisco, where they investigated 370 patients and 324 patients, and 70 or 69 of those patients had that new variant B1427-1429, which is obviously a California homegrown variant of the coronavirus, which might be more transmissible. And in that group who had those variant, more people died compared to the others, so 7 versus 5. So it might cause a more severe and more deadly disease, and some researchers think that might be responsible for up to 50%, if not more, of the surge cases we saw in late December and January. But it's not quite clear if it's able to escape the current vaccines which we have on hand.
And let's talk about the vaccine. The big news coming over the last day or so is Johnson & Johnson, that single dose that people could get and it being very effective. Tell us the latest with that vaccine, and we may see it possibly by next week.
We hope so, yeah. They are in the FDA basically under review right now for emergent use authorization. As you mentioned, Joe, it's a single-dose vaccine. It's an adenovirus, which can be stored in a refrigerator. We don't need the ice-cold freezers for that. And it's just a single shot. It showed a little less efficacy compared to the messenger RNA viruses, but with regard to inhibiting severe disease, hospitalization, ICU stay, and death, it was highly effective. So we can't wait to get our hands on it, because it will enable us to use it much broader, even in doctors' offices. We don't need vaccination centers to distribute.
Yeah, it's a huge, could be a big game changer in this pandemic. And then finally, we got to ask you, a lot of people have been infected with COVID, and there's a recovery process that they're going through, could be months later. And you've actually written about this in a new booklet that you've put out, and kind of tell us what the recovery process or what this is meant to help people with.
Well, the recovery is for all of us, basically. For those who had COVID, because there is what we call the prolonged post-acute COVID syndrome, which can last 6 to 8 months and is often characterized by non-specific symptoms like fatigue, shortness of breath, without any physiologic findings, and it just takes time. But the other thing is, of course, for all of us to recover from the socioeconomic, psychological crisis we all went through. And keep in mind, the number one thing to know is that the risk factors for dying from COVID are exactly the same risk factors which lead to heart disease, strokes, heart attacks, and so on, which is obesity, diabetes, smoking, uncontrolled hypertension. So that means, in other words, we have to actively self-address those issues. There's no magic pill, but we have to go back to our exercise regimen, to a balanced, healthy diet, to appropriate sleep patterns in order to control our risks besides medical therapy. I think that's the bottom line to know.
Dr. Ernst von Schwarz, thank you so much for joining us. We always learn a lot when we talk to you, and we will put a link with his new booklet that he's written up on our website. It'll be attached to this story. Dr. Ernst von Schwarz, thanks so much.
Thank you so much, Joe, for having me.